Hi, everybody. My name is Sarah Palmer Janvier, and I'm going to be talking to you about Kawasaki disease. Kawasaki disease is also known as Kawasaki syndrome. Kawasaki disease was named after Mr. Tamasaku Kawasaki, who is a Japanese pediatrician. In 1976 is the first time that the agent showed face, and this was in Hawaii. Today, we're going to talk about who is susceptible and who is at risk, what the infection agent is, what are the risk factors, where should testing be done, when is the infectious window, or is the person contagious, how is going to be, do we protect staff, do we prevent it, how are things sterilized, etc. So the WHO is children 5 years and younger. Kawasaki disease is a childhood vasculitis involving small and medium arteries. Over 90% of these cases occur in young children and infants. In Japan, about 112 cases per 100,000 people, children, are affected with this disease. As for some adults, percentage is very small because oftentimes it's misdiagnosed. Because this is something that happens more in children, it happens, children start showing symptoms at about 2, and it's possible that this is something that they're born with. The For adults, they believe that this is viral vector borne, or born by a super agent. So their symptoms are a lot different. So they present cervical endopathy, hepatitis, or ophthalmia. What the risk factors are is this affects your heart. So like I said previously, it causes small vessel vasculitis. Clots form inside the heart, blocking vessels, causing myocardial infarctions. So this is why it's very important to monitor symptoms. Where to get tested? Of course, this is going to be at a hospital. Unfortunately, the tests are not tests to actually say you have Kawasaki disease, but to see how it's affecting your heart. But so the first one is going to be a blood test to see what your white blood cell counts are doing and how they're doing. Electrocardiogram to see if there's any irregular heartbeats or arrhythmias. Echocardiogram to kind of see how the heart is working. Is the blood flowing the way it should be? Is it going the way it should be, etc. When to go to the doctor? If your child has had a fever for 3 days at 102.2 Fahrenheit with 4 or more symptoms, which include fever, rash, bloodshot, irritated eyes, strawberry tongue, which their tongue actually looks like an actual strawberry, swollen lymph nodes, swollen hands and feet, inflamed mouth and lips. Very important to monitor these symptoms, probably write them down and say, this is when it started, this is what's going on. And then if it's been more than 3 days, you need to go to the doctor because it's very crucial that you get treatment as soon as possible. So treatment includes aspirin, which that is an as needed. As we all understand that aspirin is not good for children up to a certain age. The other thing is gamma globulin or immune protein, which reduces the inflammation in the heart. So because this is the heart, it's crucial to get in as soon as possible, so your child is not suffering with lasting damage. Why is this important to clinic staff or patients, community, etc.? Because you want to prevent lasting health issues. The how do we protect staff? It is not contagious. This is something, like I said before, like it could, for adults, can be bacterial or vector-borne illness. Researchers are still constantly trying to figure out where it's coming from. Um, so you don't really have to concern about being around somebody who has it. The only main thing is that for long lasting concerns, you want to make sure your children are being compliant with checks where you take your children to their checkups and constantly monitoring heart issues. Even if you do it as soon as possible, get to the hospital as soon as possible, you still want to do those checkups. Also, wait to vaccinate your children. Um, the live vaccines, such as chickenpox, measles, or anything like that, can cause illness with your child because they're born live born vaccinations. So this concludes my presentation. I want to thank you guys all for listening. Hope you guys have a great day.